pleasant evening, one and everyone. So I invite and welcome you all to this third venture of 3-month certificate course on psychosomatic disorders. I invite and welcome Professor Vedagiri Ganeshan sir, the chairperson of the 3-month certificate course. He is one of the world-renowned trainer on psychological South America. He was ex-professor and head of the Department of Psychology, Bhatia University, Coimbatore. So he is also a leadership consultant for Sesi Creative Business School, Coimbatore. He is a member senate as well as syndicate member, Bhatia University. He has guided 25 candidates for the PhD, still guiding more than 10 students, both national and international universities. He was conferred with the following awards. He received gold medal during his graduation in psychology at Annamalai University, as Young Scientist Award by the Indian Science Congress Association, Calcutta, the Source Material Correction Award, and also the Visiting Association Award in the UGC Delhi. He has also organized workshops on various topics in different countries: Leipzig, Germany, Chicago, USA, Frankfurt, Germany, and Malaya, 3 universities in England alone, UNESCO, Paris, France, and also Kuala Lumpur, Malaysia. So he is a consulting editor for 6 national and international countries. So he is a senior founder of the Global Institute of Behavior Technology in Coimbatore. I heartily welcome you, sir. And once again,
so good evening, everyone. Before I speak, I welcome the today's chairperson, Professor Vedagiri Ganeshan sir, the world-renowned trainer on psychological disorders, and today's chief guest, my own teacher, Professor P.V. Ramamurthy from Venkateswara University, and another patron, Girishwar Misraji, Chief Patron Girishwar Misraji from Delhi, and another stalwart of this World Congress of Psychologists, Professor R.N. Singh ji from Uttar Pradesh. He is very much present here. I wholeheartedly welcome you, sir.
Thank you.
Then another, very recently, we wanted to take the services of S.V. Lakshman sir. He is an eminent personality, not only in India. He was in USA for more than 25 years. He moved with Obama and earlier, and this is the third venture, 3-month certificate course on psychosomatic disorders. Now, today is the inauguration day. And for this program, my own teacher, Professor P.V. Ramamurthy, accepted to be the chief guest. These 2 problems, particularly today's topic is addiction. Addiction, covers 2 aspects. One is addiction to TV, addiction to cell. These 2 are main problems which the society I pray, Lord, under the wishes, and particularly to the leadership wishes of Professor Vedagiri Ganeshan sir, the participants are going to be benefited. Thank you for all the best.
Sir, Professor B.G. Reddy sir has completed his PG and PhD from the Department of Psychology at Sri Venkateswara University, Tirupati. He has joined as lecturer in 1955, promoted as reader and professor of psychology in the same university. He has held the position of director twice in the university. He served in the same university for 30 years, taught BEd, MEd, and MSc Psychology, and he has guided 17 PhD and 18 MPhil students and written 14 psychology textbooks to Telugu Academy, Hyderabad. He is also founder General Secretary of Indian Academy of Psychologists, and he is also president of Inspired Professional Psychology Society of India and Superannuated Psychology Society of India, and Honorary President of Unemployed Psychology Society of India, and he is currently the President of World Congress Psychologists of India, of psychologists. And therefore, he has 4 psychology associations. He has held many 55 organized personally 55 physical workshops and awareness programs in various universities and colleges. As a psychologist and a lawyer, he has extended his counseling services to more than 1,800 families, including students and professionals. Thank you, sir, so much. Thank you, sir, for your short message and for giving the gist of the program. So now I request Professor Vedagiri Ganeshan, sir, to give his address.
Good evening to Professor P.V. Ramamurthy, the Chief Patron, and to also I offer my thanks to Professor Govinda Reddy for organizing this program, and good evening to other stalwarts in the association. The topic is psychosomatic illnesses, management of psychosomatic illnesses, and what psychologists can do in that. And it is very clear that psychosomatics means the thought, the feelings, the memory of the person affects the body of the person, psycho and somatic. The peptic ulcer, for example, is an outcome of excessive anger. And there are so many other things like depression, etc. And the mechanics, all the psychologists know, it starts with a feeling, and then if it is repeated again and again by flashbacks, it creates either anger or fear or worry or anxiety or sexual arousal. All these things affect the blood chemistry of the person through hormones, hormone release, and the blood gets contaminated with such biochemicals, and it affects the major organs in the body, from the brain to heart to lungs to kidney, etc. Of course, there is medical management is there, but the medical management is only temporary, because if the repetition of the emotion happens over the years, that means it is continuously attacking the blood chemistry. So what is required is that cognitive shift can be given only by psychosomatic illnesses management, which is a behavioral management, cognitive behavior therapy, rational emotive therapy, and there are so many other ways in which things can be handled. And as Professor Govinda Reddy has pointed out, in US, the mental illness is on the increase. In India also it is on the increase because of the stress. So how to reduce it is, we do not have enough professionals in medicine or in clinical psychology also, or practicing psychologists are also limited. Teaching psychologists are there, but practicing psychologists have to come up, and the teaching psychologists can easily start practicing, which is not difficult because they are thorough with the theory aspect and the experimental aspect. And I wish more and more of Indian psychologists come into practice, private practice, or in the department also, they can start the counseling centers and start helping the students or the community in general. So with this brief introduction, I would like to start the session for today. As our Govinda Reddy has pointed out, 2 addictions. One is addiction to TV and addiction to electronic media like cell, using of cell, WhatsApp, etc. Now, the addiction happens because experiments have been shown even on animals. They get excited to the electronic media. If the dogs watch some kind of games played by dogs, they get excited. So it is the fault of the brain. The brain gets excited, the hormones get released, and they get addicted to that. So this is a psychophysiological aspect. So one of the very important thing which I would like to suggest is, you cannot ask the person to stop watching the TV or stop using the cell phone or WhatsApp. But instead of totally trying to prevent that behavior, what is required is a self-declared goal. The self-declared goal by a client is very important, and it is very easy to do. So, for example, a college student is watching WhatsApp continuously throughout night, they may be doing, or even the day they may be doing, because it is vacation or it's a holiday weekend. And the parents, they ask the person to stop. When they force the person to stop abruptly, there have been suicides which have happened in some states in India because the parents are stopping the TV watching or the WhatsApp watching. So the person gets disturbed. It is just like withdrawal symptom, which happens when a person is stopped from drinking alcohol. They get jittery, they get agitated. It's a psychophysiological arousal happens. Either they become aggressive or the aggression turns inward and they become intrapunitive. They hurt themselves, or extrapunitive. They will start hurting others within the family. So one of the best way is to have a midway program. What is the midway program? We can ask the person, affected person who is addicted to the electronic media to have a small break, very, very small break. If they watch for 1 hour, either the TV or the WhatsApp, give a small gap. The small gap is, we should not say which is small gap, but the candidate has to declare the gap. They will say, I'll give a 2 minutes break and continue for half an hour. Every half an hour, 2 minutes break. That's a wonderful thing. What is this 2 minutes break? It develops a kind of psychophysiological inhibition, and the brain learns to apply breaks. Just a 2 minutes break, then 30 minutes of watching TV or whatever. Okay. Or in the case of TV, during the advertisement period, they can switch off the sound. They can put it to mute. Okay. Then they can switch on when the film comes or the serial comes. So by that, the brain learns to give small breaks or inhibition. And later, after 1 week, you can again ask the candidate, can you extend the breaks for a little longer period? Then they will say maybe 5 minutes. Good, wonderful. Because the psychoneurological aspect gets conditioned to the habit of self-control. This is gradually building a self-control to give a small break, 2 minutes to 5 minutes. And then after a week, again ask how much time, maybe seven minutes. Okay, go ahead. Then if you go up to 10 minutes break, you have already succeeded in handling the addiction to electronic media. And this always works. And I wish the participants to try this when you come across cases like addiction to electronic media. I'm looking forward to any comment or observation. Please come forward.
Sir, thank you so much. It is a wonderful tip actually. Actually, nowadays, people are watching TVs in the homes, but young people are watching Netflix, AHA. These are the series. Actually, I only did last 3 days back. I was shocked actually what I did actually from the afternoon to 2 p.m. 10:30 p.m.
Okay.
I watched one web series almost uh, 8 to 9 hours continuously.
Okay.
I was shocked after watching this. So these days, young people are following these web series. So how can uh, we can get breaks from this?
Okay. Now, what happens when people watch a film in the theater or watch anything in the TV or WhatsApp? It may be a dance or it may be whatever, or drama or a scene or dance or for example, if you see people who go to watch games like cricket or football or baseball, they get involved and they identify so much that when somebody kicks the ball, they will feel as if they are kicking. This is a kind of visualization which happens in the brain of the person. They identify with a hero or heroine, and it is a trip. It is just like a trip which people are taking by taking drugs. So they are having a high feeling. So many chemical things are happening in the brain, and the blood chemistry changes, and they get addicted to that. Let us not go into the biochemistry of the blood. Okay. Now, one of the important thing is how do you divert them from that addiction? That is a very important thing. So when you say about Netflix and watching from afternoon to night or midnight, what I suggest is not only in this case, but any kind of mental illness problem, people have been habituated to live in the world of imagination. A poet starts imagining, comes back with a poem. A cinema director imagines, comes back with a script. Okay. And similarly, one can think and imagine and come back to normal life. But these people who are suffering and wasting their time, and the time is life, they are wasting their life, not just time, they are wasting their life, which can be productive, either for themselves or for others. But they are wasting their life. Now, how to save these people from wasting their life and how to make them productive to themselves and productive to others and productive to the nation is a very important question. So what I generally suggest is when people are in imagination, pull them down to some physical activity, what we call as a grounding. The plane is flying and flying and flying. All the fuel will be wasted. So if you want to save the fuel, it should ground and take some time, refill, again fly. Okay. Similarly, the general thing of therapy for these people is you have to ask them to engage in some physical activity while the mental activity can also go on. Don't ask them to stop that. They cannot stop because they are addicted, because there are biochemical changes which make them just like alcohol. The alcohol asks for more alcohol, like that. Excitement asks for more excitement. Okay. And to change that kind of attitude of addiction, what you do is ask them to engage in some physical activity while they are watching a TV, dance or music or a theme. What are the physical activities? You have to be creative, innovative in developing activities. What is the activity? I would say simply like this. Clench your fingers and open it. Keep on doing it. You watch anything, keep on doing it. When you watch, you are going into the world of imagination. When you do it, you are coming back to reality. This is reality, here and now, and watch. Go to imagination, come back. That is how whites are able to come back. Imagine and come back. Scientists go for imagination and they come back and make a draft. Okay? But these people, they get lost in imagination. That is what is mental illness. Mental illness is not extreme things like schizophrenia. There is also mental illness in the sense they travel to a world of imagination and get stuck and waste an hour or 2 or 3 or half a day, which can be productive for themselves and the family and the nation. So one of the behavioral prescription which I suggest is engage in some activity like this. You need not count, simply go on doing it and watch also. Watching, you go there in the imagination, and when you do it, you come back here. It can be any kind of moment like that. But this has to go on. It goes on. They are not lost into the world of imagination. Being lost into the world of imagination is madness. Otherwise, temporarily they are going mad and they are becoming unproductive. Okay? Or it can be tapping the feet on the ground. Okay? Like the tailors do. That moment can go on. You do it. Okay? Or at least when the advertisement comes, do it. If it is an exciting situation in the scene, you may not be able to do because you are drawn into the world of imagination. But as far as some song is going on, tap your feet. Okay? Something like that. And another thing is take more and more water. When you take more water, this addiction-oriented biochemical in the blood gets diluted. So how much water, if you ask me, I would say take to the level of satiation. Okay? 1 glass, 2 or 3, where you cannot take any more. To the level of satiation, you take water because your addiction is in the blood. Okay? Addiction is in the brain. Addiction is in the whole body. So there should be psychoneural activity, neuromuscular activity, okay, or water and the movement. And in case dancing is going on, you start dancing. Don't just sit there and then stretch and watch the dance. When you watch the dance, you become the dancer. Don't do it. Actually do the dancing. Okay? And that will be good. So behavioral prescription is, one is hand movement, leg movement, okay, tapping, okay, or squeezing the arm, fingers like that, okay. That brings you to reality, then you can fly into imagination, come back and take more and more water. That will dilute the addiction aspect. So these are the 3 suggestions which I suggest.
Thank you so much.
Welcome.
You are right.
Okay.
Sir, I have a question, sir.
Yeah.
It's been privileged to hear from you all. I hope my voice is audible, right, sir?
Yeah,
Yes.
you are audible.
Yeah, okay. Sir, my question is, so we know like within the walls, when when a counselor and a counselor are talking to each other and coming to an agreement of 5 minutes or a 2-minute free window or something, when we come to the agreement, then after they left these walls out, they might not follow the pattern or the things which they have agreed to. They would not stick to it. There are some possibilities too. So again, they come back for the next visit saying that we haven't followed it, or somehow we missed it, or some of the other reasons they might come up saying it. So in such scenarios, how can we handle this?
Actually, in the counseling process, non-directive counseling is there. And directive counseling is also there. But when you want to bring about dramatic results, one of the things is you should switch over to direct counseling, not non-directive counseling. Okay? Directive counseling means you are not dominating, controlling, dictating, but you are prescribing some behaviors. And you also monitor that behavior within the clinic. But my recommendation is you should have a center where you can admit and treat the person continuously for a week or 2 weeks, maximum 2 weeks. Extreme cases, admit them for 2 weeks. Otherwise, 1 week is enough. Just one full day is not enough. Few hours is not enough. Okay. But all these problems are very complex. Say, for example, I say, flex your fingers like this. If you prescribe like that, nobody is going to do it. So you switch on the TV in the clinic and ask them to watch and ask them to do it. Okay. So it's like a training actually. Counseling is a training. You are a trainer and the person is a trainee. Then the brain will understand, okay, I have to do it. But you say, go and do it. Nobody will do it. Okay. It is just like ICU treatment versus OP treatment. OP prescription is there, they go and take. But these people are not amenable to OP. They are amenable only to ICU, intensive care unit. But you can't have an intensive care unit, but can you spend more time with a client with a complex problem like this, addiction? Okay, at least one full day, can you keep the person and train the person, okay, to take more and more water, or other things are also there, like slowly breathe in and out while you are watching the TV. Slowly breathe in and out while you are watching the TV, because TV itself is a stimulation, or WhatsApp is a stimulation. So produce that reality and ask them to engage in the slow breathing out and in. There are so many variations in the slow breathing in and out. Okay. For example, I would suggest, I am not only telling for this addiction, I'm telling for all complex cases. Ask them to breathe out through the mouth and inhale through the nose. Breathe out through the mouth and inhale through the nose, and keep watching the TV. Now, what it is known as a diversional therapy. We are diverting the attention of the person, or diverting the attention of the brain. Actually, let us talk about the brain. The brain is trained to engage in more than one activity. One activity is watching TV. Another activity is watching your breathing. Breathe out through the mouth and inhale through the nose and watch the TV. The TV program may not be exciting, but if it is exciting, it leads to addiction. Okay, you watch the TV and engage in some physical activity. I'm giving 2-3 methods. You can always innovate more techniques of physical engagement versus mental engagement. Watching the TV is also visual. It is physical and mental also. But simultaneously, can they do something else also? What you can call as a diversional therapy, and it develops a reciprocal inhibition, which is neurophysiological. Okay, so you have to spend at least few hours, 2-3 hours, minimum half a day, and ask them to come again. If you can't admit and treat, ask them to come every day for 1 week. Spend half a day with them. Don't take up too many cases. Okay, it's almost like a surgical procedure. And if you are committed and the client is committed, definitely you will see the result. So it is not an empty prescribing a drug and then leaving the case. Okay, it is more like taking control of the behavior and thinking and feelings of the person. Because the more you attend to a person, the person becomes all right. Even in the medical field, if the doctor goes on chatting with the client, that itself is a therapy. Highly qualified people spending more time with their client, whether they are surgeon or MD, the person feels I am being attended to. That itself makes a difference. The commitment of the therapist. For example, the Hawthorne studies, which all of us would have studied in the industrial psychology. Okay, the Hawthorne experiment, they increase the light or decrease the light to almost invisible condition, but still the workers worked so well. And the reason is, it is a human relations, because they said we are chosen and people are attending to our work, so we have to do well. Okay, that kind of commitment. So if the therapist is committed and involve the commitment of the client, that itself will bring about a change. That is the effect of ICU. The doctor, the nurse, and other physiotherapists. Then the person feels, okay, I'm being attended to, that itself is a great feeling. And that brings about marvelous results. Okay. So don't see 10 cases per day. See 1 or 2 cases per day. Spend a minimum of 1 hour to 3 hours per candidate and ask them to come back again next day for 1 week. Okay. If you invest your time and the client invests time, they will become all right. Even the so-called very severe cases, incurable cases, can be made to become all right if we devote time, like what the surgeons do. Some surgeons operate for 17 hours standing, not sleeping. Okay, that kind of involvement brings about the result. But all the people need not do it, but depends upon the situation, depends upon the case, the complexity. If you spend time like that, invest time, you will get very good return. Okay, so you will be also happy. You will have the high feeling. That's what I would suggest. But if you say nothing is working, the technique is useful, but the administration requires more time between the client and the therapist or the counselor. Okay, that's my suggestion.
Thank you so much, sir. It cleared my doubts. And I have one last question to it.
Yes.
So mostly, people might find some pleasure or some advantage, so they try to seek towards these addictions using a
Yes.
mobile or anything. There is
Yes.
some intent or something that is provoking them to do that. So
Yes.
ideally, it would be again they would boil down to their core beliefs of which is driving them to
Okay.
involve into such activities. So
Okay.
initially, when they are so addicted, and that will not give us a time, or at that point of time, it would be difficult to trace back to their core beliefs and try to change their behavior from the roots. So when that intervention can be given, or like how that can be done?
Yeah, that's right. That's a very practical question you have asked. See, for example, somebody is having a nagging wife, the fellow would like to escape into TV. Okay. So just treating the person alone will not help. But how to handle the nagging wife is also required. So I used to say always, see, a doctor takes a case of typhoid, they treat only one person. But when you have a psychological, psychosomatic problem or a mental health problem, you have to treat the whole family. Okay. The husband has a problem, the wife has to be also treated or trained. I would always say trained. Wife is to be trained, husband is to be trained, children have to be trained. The father-in-law, mother-in-law have to be trained. So these are the environmental factors which will trigger. Okay. So doctors say you should avoid contamination. Okay. Otherwise, the illness will go up. In case of allergies, they tell you how to keep off from certain materials which will stimulate allergies like that. But here, you can't keep away the person from the family. So you should tell the person how to handle the wife, and you have to tell the wife how to cooperate and how the mother-in-law is to cooperate. So then things become all right. So it's more of a family therapy to avoid addiction. When you see alcohol addiction, etc., there is always a kind of factor which is hurting the person. Somebody gets insulted or hurt. To escape from that, he goes to addiction. So family therapy is recommended. And you will always find there is a need for adjustment by the family members, and how to adjust, you have to tell them. You have to train them actually.
So to summarize the understanding which you have gotten, so initially we would help them to get that addiction down, and after a certain level of time, then we should start looking into the other aspects of his life so that he will not fall back to the same addiction.
Yes, yes. that kind of, they should not resume into the same problem. Okay. So what is required is you have to simultaneously treat the subject or the client as well as the family members who are creating pain for the person. And from the pain, the person is trying to escape from the mother-in-law or from the wife or from the husband. So how to handle the wife, you have to tell. How to handle the husband or mother-in-law or father-in-law, you have to tell. Okay. So the concept is you have to not focus on the client alone, the surrounding people in the climate. Okay. But if you can't handle them, they will not come to the center for training. You should tell this client how to adapt to that person by assertiveness. Okay. Assertiveness is one of the very important things. If it is not there, then people are taken for a ride. Okay, a very calm and submissive person suffers. So the person should become assertive, not aggressive. So that midpoint, how to reach there has to be trained.
Yeah, thank you so much, sir.
Well,
Good evening, sir.
good evening.
Sir.
I'm not able to see your video.
Yeah.
I'm not able to see.
Sir,
Video
now.
is good or not?
Yes,
Tell
sir.
your name. Tell your name.
Harisha.
Okay.
Sir, nowadays people are addicted to serials, sir.
Mm.
I have seen so many people who are addicted to serials.
Yes.
Even if they are out also, at that time they are feeling more anxious to see the serials.
Okay.
Stopping their work and coming to the home for seeing serials only.
Yeah. Yeah.
So we control.
Yeah. No, that means in the office, they are not controlling these people. Okay. The head of the department is not okay. So you have to make the HOD to tighten up. That is why, even in the medical parlance, what they say is you have to keep off from allergens. You should not take oil baths. Okay? Like that. In any medical practice, whether it's Siddha, Ayurveda, or allopathy, there are three conditions. Do it, don't do it, etc. Okay, that is why they admit and treat. So I always recommend admit and treat, or spend more time with a client. Okay, if the person goes on crying, and to get out of the depression the person is having, looking at the TV, then you should remove the depressants which are creating the problem. Whether the depression is in the office or at home, whether it is a man or a woman, all those things you have to do. And TV addiction, it's a general comment. We are not having any data. People say people are watching TV or WhatsApp and things like that, but don't talk about a general case. But take a specific case. It's just like an experimentation. Okay, individual you take, work on the person, you can bring about the change. That's why I told about the Hawthorne experiment. Okay, people are surprised how people can work in such dim light. Okay, they said, anyway, you are attending to us, so we are able to work. Okay, it is the care of the surgeon or the MD or the psychologist which can bring about more tangible results. So my recommendation is spend more time with the client. Okay, technique or no technique, spend more time. And with technique, it will definitely work. And you have to train them. It's more of a training. Okay, cricketers are trained. Always there is a coach. I would say we have to become like a coach. Then we bring about wonderful results. And there are a number of techniques which you can look into on behavior therapy by Joseph Wolpe, Practice of Behavior Therapy, and so many other books are there by experts. Okay, so we can do that.
Sir, actually, my relative only, sir.
Ah.
If they are very anxious to see TV, Even if they, how can we mold them, sir?
What is the age of the person?
65.
Okay.
He have two TV.
Man or woman? Man or woman? Man. Is he well adjusted with his wife?
Yes, yes, yes.
Both of them watch the TV.
Both are watching the TV.
Okay. Then why are you bothered about it? Why do you call it 50 plus? They have retired. Session-1 is over. They are just relaxing, watching the TV. You call it an addiction. What is it? What is the definition of addiction? Is it will interfere with the effectiveness of the person. If he is not able to cook or take care of the household activities, and similarly the man also is not productive. Okay? The whole problem for retired people is they become unproductive. That itself will kill them. Okay? So my recommendation for such people is ask them to engage in some social service. Okay? The question is what to do. There is no purpose in life. So they will be keeping on watching TV and die within 5 years after retirement. 60 retirement, for example, 58 or 60. Within 5 years, most people die. There is no engagement. So they have to be useful to others. In what way they can be useful to others? The 60 plus couple can be helpful to others. The children are married and settled away. Boys and girls or whatever. Okay. Now tell them what we can do for the community. If they get engaged, okay, they will be addicted with some useful activity. The pro-social behavior. That's what I would recommend. You have to look at it not just as addiction. What are the positive factors? That's why I asked about the age, the husband and wife, what are them cooking and watching? Okay, can they cook some food and give it to beggars, or go to a temple and give some prasad weekly twice, not every day? Then they start caring about others. Once they care about others, they are here and now. But here, they are not here and now. That is the whole problem. In addiction, people are not here and now. By moving the fingers, when I say they are here and now, taking more and more water, they are here and now. Otherwise, they are floating in imagination. Whether it is a film, which is a kind of a shadow one, okay, which is a tragic thing or a funny thing, a dancing, they are entering into imagination, okay, world of imagination. That really hurts them, and they develop so many illnesses. So one of the things is physical activity. Second thing is social activity. At least make phone call to friends. Go to a temple, do some puja weekly once at least, and if possible, give something to the poor and needy. Then they develop a purpose in life. Otherwise, there is no purpose. Retired, okay. Pension is coming. They just want to relax and watch TV, and you go and disturb them. But tell them what you can do for others. Ask them to join some club, like Lions Club, Rotary Club. There are projects, okay, that will keep them busy. The physical involvement is very important. They have to be physically active. Otherwise, they will die early. You have to warn them, okay. You have to tell them you will die very early. You will develop sickness. So be active, do something for others. Okay.
Disorders and all, I wanted to know about children who go through this addiction. Since if it's going to be adults, they can have their own, as you said, that self-declared goal. But when it's about children, it's not about, they cannot have that self-declared goal and all these things. No, so like they do not want to come out of it. When it's comparatively to an adult, they actually want to come out of it. What can be done for children, sir? And they also become very hyper.
Age
And they
of
become
the children.
fidgety when it becomes
What is the age?
like addictive. Any age, so like I'm asking pre-teen or teen, any age in the school days, I'm asking about a general children.
Mercy, when you discuss about a problem, you should be specific. It can be 5-year-old or 15-year-old. You have to be specific.
Maybe 6 to 8 standard, like teen, 12 to 13.
You talk about a particular age.
Age.
Is it 13 or 15?
So any at the 13 teens.
You see, there is no sarva roga nivarani. Okay? For everything, one pill will not help. For everything, different pills are required. That's
Okay.
why I wanted to be specific. Anyway, one of the things is, can the parents play with the children? Engage in play. Okay. The parental neglect can cause addiction. Okay. Some kind of play, even chess is a sedentary play, or carom board, sedentary play. But when parents are involved, children are excited. But if they are let loose, okay, then that creates a problem of addiction. Okay. As somebody said, when the child is doing some mischief, they give a cell phone. Okay. That should not be the case. Can you spend time, quality time of parents, if they are always beating and hurting and insulting, using abusive words? The child feels sick and it wants to enter into a world of imagination. The TV or net, everything is a world of imagination. Okay. So there is no physical involvement. They are not kept in reality. Okay. So you have to diagnose into the family. That's why I said ask the age, class, parents, what they are doing, how much time they spend with the child. Is a quality time. What is quality time? Not hurting the child with words or physical punishment. The child should love to be with the parents. If they have the loving, caring parents, it will not lead to this kind of addictions. So that is a behavioral prescription, what I would recommend. Okay. Something has to be done with parents. Always don't talk about the child. The surrounding, number of people, what they are doing, they may be causing the addiction because they are hurting. That's why the child is escaping into TV. Okay.
Okay, sir. Thank you, sir. Thank you.
Welcome.
Here, one technical coordinator is with me. He is the, just without him, the program will also not be grand success. So he is Dr. Anand. As per the name indicates, he is quite lovable Anand. Right? Thank you. Ramadevi, kindly.
I'm sir's student, sir.
Oh,
Welcome, sir. Thank you for your cooperation and for the technical support, sir.
Thank you, madam.
Okay, fine, madam. Madam,
Today we have discussed about the web series addiction and addiction for TV. So mobile, it was also discussed in previous sessions. So in the web series or in any TV series or serials which we are addicted, you have to involve them in the physical activity along with watching the TV or series. So the steps involved are, while watching the TV, open and close your hands or twist a movement of, like any physical activity which deviates the mental activity of watching the TV to the physical activity, either tapping the feet or open and closing the face or shaking of the hands or any such thing which deviates the attention to some level. So, and one more thing is, take more and more on water till you reach the saturation level, because the water dissolves the addiction chemicals, so that we can reduce the addiction levels by the more intake of water. So these two ways we can involve in creating the attention or the focus of the watching the television, so that they won't get addicted so often. So there is two ways of directive counseling. There are three ways: directly counseling and indirectly counseling. So depending on the case, we have to use either directive method or indirective method. So one important thing which clinicians are always emphasize is to spend time with the client. It's not just saying that and asking them to do as homework, but instead we have to make them sit and do, which works effectively in every case. So it is more important to spend more and more time, as much as time possible, with the client. If it is possible, it is better to get them admitted in the hospital or in the clinic where you are working, or if the the feasibilities or the situations, or either you can make them come and spend 2 to 3 hours or half a day of maximum for a minimum of 1 week and a maximum of 3 weeks. So in case of children, it is required to ask the parents to spend some quality time with the children while they are watching, or we can have a small break, like half an hour of watching TV and 1 minute of break. And gradually we can increase the 1 minute of break to 2 minutes, 3 minutes, and with the increase we can reduce the TV time. And in that break time we can involve them in some productive things so that they get more interested in doing the productive things. It has to be very creative, not just doing it. We have to spend time. I mean, the parents have to spend time so that they can learn well and reduce their TV time. So these are the two cases which we have discussed in this, and I hope I have cleared, summarized the session. Summarize the cases. So it's time to wind up. Shall I?
Yeah, before winding up,
Thank you, everyone. Have a pleasant evening and good night.
Good night.